MLT Case Studies Series 13A topic on unraveling platelet dysfunction, a case study on aspirin-induced bleeding, a comprehensive diagnostic approach to platelet function testing, introduction to platelet function tests. Platelet function tests evaluate the efficiency of platelets in hemostasis, including their ability to adhere to damaged blood vessels, aggregate with each other, and support coagulation processes. Common tests include platelet aggregation tests, PFA 100, Platelet Function Analyzer 100, Verify Now, and TEG, thromboelastography. Purpose: diagnose conditions associated with abnormal platelet function like Glanzmann thrombocythemia, Bernard-Soulier syndrome, and von Willebrand disease. Monitor the efficacy of antiplatelet therapy, e.g., aspirin, clopidogrel. Assess bleeding risk before surgical procedures. Methodologies: platelet aggregation test measures the extent to which platelets clump together in response to various agonists, ADP, collagen, epinephrine, ristocetin. PFA 100 simulates the process of platelet adhesion and aggregation under high shear conditions, using collagen and either epinephrine or ADP. Verify Now, a point-of-care test that assesses platelet reactivity in whole blood, specifically used to monitor antiplatelet therapy. TEG provides information on the kinetics of clot formation, strength, and dissolution, reflecting overall hemostasis, including platelet function. Interpretation of results: normal results indicate proper functioning of platelets. Abnormal results may suggest platelet dysfunction, inherited or acquired, von Willebrand disease, or ineffective response to antiplatelet therapy. Sample case study: background patient, 45-year-old male presenting symptoms, frequent nosebleeds, easy bruising. Medical history: hypertension, on aspirin therapy. Objective: to assess platelet function and diagnose the underlying cause of bleeding tendency. Tests performed: complete blood count, CBC, platelet aggregation test. PFA 100 results: CBC, within normal limits. Platelet aggregation test, reduced aggregation response to ADP and collagen. PFA 100, prolonged closure times with both epinephrine and ADP cartridges. Interpretation: the normal CBC rules out thrombocytopenia as a cause of bleeding. The reduced aggregation response in the platelet aggregation test and prolonged closure times in the PFA 100 suggest an underlying platelet function disorder. Given the patient's history of aspirin use, aspirin-induced platelet dysfunction is a likely diagnosis. However, other causes of acquired platelet function disorders, such as other medications or systemic diseases, should also be considered. Clinical significance: the findings indicate aspirin-induced platelet dysfunction, contributing to the patient's bleeding symptoms. Management may involve reviewing the necessity of aspirin therapy, considering its risks and benefits. Additional tests may be warranted to rule out other causes of acquired platelet dysfunction. Conclusion: this case highlights the importance of platelet function tests in diagnosing and managing patients with bleeding disorders. By understanding the methodologies and interpretation of these tests, medical lab technologists can play a crucial role in the clinical team, contributing to effective patient care and treatment planning.